Dr. Salahuddin Blasa, who has extensive clinical and research expertise in the field of immunotherapy, stem cell therapy, laser therapy, and pain management. He earned his medical degree at Triple E University in Tripoli, Libya, and is now licensed in the United States. He was a researcher in immunotherapy at Baylor University in Texas and is now the Chief Executive Officer and the founder of Nitromedicine, LLC in Easton, Maryland. Dr. Blasa is published and he is a frequent guest speaker at renowned venues such as SPIE, International Society for Optical Engineering, American Society for Laser Medicine and Surgery, Nitric Oxide Society, American Academy of Anti-Aging Medicine, the International Society for Medical Laser Application, and Photobiology Society. I met Dr. Blasa in Germany this June when we were both speaking at the International Society for Medical Laser Application. And we met in a stem cell laser workshop on a coffee break. And within about 3 minutes of meeting each other, we wound up in a discussion about spirituality. So I decided if that happened, we were bound to be friends.
Good evening. So, I'm the founder and author of Nitromedicine, and I'd like to give the credit for doctors who joined the team of Nitromedicine, starting with Dr. Michael Weber. He's a general practitioner, and he's a pioneer in photomedicine, photodynamic therapy for cancer, and also for stem cells in Europe. Dr. Norman Schilling, he's the energy medicine pioneer, retired neurosurgeon and nitromedicine consultant. Dr. Robert Quinn is a regenerative medicine pharmacist and also nitromedicine COO. Dr. Len Saputo, he is an internist and he is the clinical pioneer of photomedicine and nitromedicine consultant. Dr. Michael Hamlin, he is a photomedicine pioneer academically, a PhD, Wellness Center investigator, and Harvard Medical School a professor, and published 2 articles with him, 2014 and 2016. Traveling next month to India, presenting Nitromedicine in India as well. And then we have Dr. Yusuf Ureta. He is the director of Nitromedicine, the clinical director of Nitromedicine. He is the stem cell therapy pioneer, orthopedic surgeon, and Nitromedicine clinical director. And he's applying the protocols of nitromedicine from A to Z. So what is our mission? Is translating alternative medicine into evidence-based medicine. When we talk about evidence-based medicine, means that we know how it works, and we know how it works, and also we know how to measure its efficacy. And so what is nitromedicine? It is a new medical specialty focused on modulating nitroredox-sensitive biochemical pathways to manage oxidative stress-related disease and enhance stem cell therapy. It has been known since the discovery of the biological rule of nitric oxide in the 1980s that supplying nitric oxide donors can have many beneficial effects in different conditions by stimulating stem cells and modulating the immune response. However, there also exists a substantial risk of side effects with long-term use. Excess nitric oxide can inhibit mitochondrial metabolism by binding to cytochrome oxidase and also produce reactive nitrogen species peroxynitrate by reacting with reactive oxygen species. To avoid these potential damaging side effects, we propose to combine the use of nitric oxide donor with 4 additional components. Initially, we believe that additional antioxidants such as phenols, polyphenols, and vitamins can neutralize the reactive oxygen species and reactive nitrogen species. Secondly, we believe that application of appropriate wavelengths and dosage of light, blue, red, and near-infrared, depending on the exact condition being treated, will dissociate nitric oxide from cytochrome oxidase and other storage sites, those restoring mitochondrial ATP production, stimulating healing in many situations. Thirdly, we believe in detoxification, will remove the pathological free radical generators and increase the nitric oxide bioavailability. Lastly, by delivering the electron to the body through electrotherapy, we might help to saturate free radicals with electron, those eliminating underlying oxidative stress, stabilizing mitochondria, preventing further formation of prolonged pathological free radicals, and increasing the nitric oxide bioavailability. This combination therapy may be applied to treat and prevent large variety of oxidative stress-related disease, such as degenerative disease, immunological disease, chronic infectious disease, cancer, and a broad range of unmet medical needs involving chronic inflammation with emphasis on pain management. So basically, using nitric oxide by itself is not a good idea because long-term use of nitric oxide donors can lead to development of peroxynitrate, and peroxynitrate does the opposite of what nitric oxide do. And so how we can get rid from this peroxynitrate? We give antioxidants, thiols, vitamin C, and I think that's what I recommend for patient who is taking nitroglycerin for angina. I think it's better for them, or I recommend them to use thiols, vitamin C's, polyphenols, possibly photomedicine to neutralize the free radicals, because nitroglycerin, if you give it in a long period of time as a nitric oxide donors, it may help in the acute condition, but when it comes into chronic condition, those nitric oxide that's being delivered or from the nitroglycerin, they can react with reactive oxygen species and become peroxynitrate and eats the heart and cause damaging to the heart. In addition to that, you will develop what we call tolerance to the nitroglycerin. To prevent the tolerance, which is caused by the peroxynitrate that's being generated from reaction of nitric oxide with reactive oxygen species, I do recommend to add antioxidants. And this antioxidant could be chemical, thiols, polyphenols, vitamins. It could be energy, which is the light therapy, sono, photo, electrotherapy. They work all as potential antioxidant, and we're going to explain how phototherapy is a potential antioxidant. Electrotherapy is also potential antioxidant. Chelation therapy is really antioxidant because what you're doing, you're removing the pathological free radicals. So let's give an example to understand nitroredox. What is the concept behind nitroredox? And let's start with vitamin C. We know that when we give vitamin C in low dose, it will neutralize the free radicals, which leads to increase in the nitric oxide bioavailability. That's a low dose of vitamin C. But when we give the vitamin C in high dose, and we use it for managing cancers, it actually works as a pro-oxidant, right? I think some of you have been using high dose vitamin C to treat cancer. And so the vitamin C in high dose, it works as a pro-oxidant. So I think the better term to describe the effect of vitamin C is use the term of nitroredox modulator instead of calling them antioxidant, because it depends on the dose. If it's low, they work as antioxidant, they increase the nitric oxide bioavailability, but it's in high dose, they work as pro-oxidant, and they generate free radicals in the cancer, and they kill the cancer. So that can be applied to all other modalities, whether it is electro, or photo, or sono, ultrasound, or energy medicine. I think the better word to describe their effect is calling them nitroredox modulators. So Nitromedicine represents a new era in medicine. By modulation of nitroredox sensitive biochemical pathway, we can enhance stem cell therapy, manage and prevent oxidative stress-related diseases. Those diseases are oxidative stress level now, degenerative disease, immunological disease, chronic infectious disease, cancer, plus a broad range of unmet medical needs involving chronic inflammation with emphasis on pain management. So here we would divide the nitroredox modulators into three classifications: biological, chemical, energy. Nitroredox biological modulators such as stem cells, plasma-rich platelets are very rich with nitroredox chemical modulators such as thiols, nitric oxide, growth factors, cytokines, redox enzymes. Nitroredox chemical modulators, they are thiols, nitric oxide donors, polyphenols like curcumin, ECGC, ozone, hydrogen, carbon dioxide, sex hormone, thyroid hormone, antioxidant, enzymes, cytokines, vitamins, and detoxification. Then we have the energy, nitric redox modulator, phototherapy, electrotherapy, electromagnetic therapy, cryotherapy, sonotherapy, exercise, acupuncture, massage, even what we call it, the fascia manipulation. A part of it works through nitric redox modulation, physical therapy, and low-calorie intake. They are all nitric redox modulators. I think a lot of us here that we have a problem of understanding the word redox potential because of redox modulation, redox sensitive biochemical pathway, because this term is a new term. It's being published from 2010 all the way to now. And we did not have it in our medical school, the word redox potential. We know and very familiar about pH, right? And so I think let's start learning about things that we know, and then we go to things that we want to learn or we want to know. Let's start with potential of hydrogen, which is a pH. We know the potential of hydrogen pH is minus logarithm the concentration of the hydrogen, which range from 1 to 14. But what is the pH actually we are measuring? We are measuring the tendency of the substance to attract hydrogen ion. Okay? So if it's more alkaline, 14, that's going to be more attraction to the hydrogen. If it's 1, you have less attraction to the hydrogen. While redox potential, it's measured by minus millivolt to plus millivolt. In the cell, inside the cytosol, it's around 400 to 200. And inside the mitochondria and the matrix, it's around 400 positive. Cytosol, it will be minus 300. In the matrix of mitochondria, it will be actually positive 800, not 400, 800, sorry. And what the redox potential we are measuring the tendency of the substance to attract the electron. So that's the difference between potential of hydrogen and redox potential. Now, potential of hydrogen, which is pH, as we know, it regulates the cellular enzymes, electrical activities, right? And the redox potential, actually, it regulates the cellular enzymes, yes, electrical activity, energy flow, and the gene expression. And we're going to have a lot of examples in the coming slides explaining all of this. The other thing about the pH, it regulates the cardiovascular physiology, right? The respiratory physiology, the renal physiology. We have receptors that sense the pH, and when it drifts, it causes a change in the physiology of cardiovascular to fix that pH all the time, and that now range to 7.35. While the redox potential regulates the cell cycle. Imagine that the cell is being driven by redox potential. So it divides and differentiates by the effect of the redox potential. It senses the redox potential and it drives the cells to divide. It regulates the cardiac rhythm, the heart rhythm, the beating of the heart is controlled by redox potential. It regulates the circadian rhythm, the sleep-awake cycle. It regulates the autonomic nervous system, the balance, the tone of sympathetic and parasympathetic. It regulates the brain plasticity, which includes the phantom pain. It has to do with redox. It also regulates the insulin sensitivity, the vascular endothelial function, the immune system. So we see here that redox potential is being overlooked by the medical community. And I think the reason that we fail in managing chronic disease because of the lack of understanding of the critical role of redox potential in the pathology or in the pathogenesis of the chronic disease. And nitromedicine is all about shining the light on this very important vital factor, which is the redox potential. So what would happen if you have a normal pH sensitive metabolism? As we know, this is something we know, it's a traditional medicine. It leads to acute clinical condition, acidosis, alkalosis, electrolytes, imbalance, convulsion, arrhythmia, confusion, coma, cardiac arrest. But abnormal redox, nitroredox sensitive metabolism leads to chronic clinical conditions, which is oxidative stress related diseases such as degenerative disease, autoimmune disease, chronic inflammatory disease, and cancers. So we need to know what is the relationship between redox potential and hydrogen potential. There is really an interaction between the redox potential and hydrogen potential in the mitochondria. The fact is that when we are trying to extract the energy from the food, what we do, we oxidize the sugar or the fat or the amino acids into NADH, NADH, right? And then that NADH contains an electron which has high energy. And then that electron will move through the electron transport chain and it will be ending up into oxygen and become superoxide. Of course, the energy that's being released from that electron as it moves from high potential of electrons, energy into lower, that energy will be used to pump the hydrogen ions into the mitochondrial intermembrane space, and develop what we call the hydrogen gradient potential, right? Where the matrix is alkaline and the intermitochondrial or the mitochondrial inner membrane is acidic. So this hydrogen gradient will be its potential of energy. It will be converted into chemical potential of ATP as the hydrogen moves from high concentration to low concentration. So we see here that the energy starts from the redox potential gradients between the matrix, which contain a lot of superoxide, which has a redox potential of plus 800. That is they are starving, they are attracting, they want the electrons, right? And the NADH, which is inside the cytosol, and the redox potential there is around minus 400, as you see it there. And so that redox potential will be converted into hydrogen redox potential gradients, will convert into hydrogen potential gradients, which is a form of energy, potential energy, and then the hydrogen potential gradients will convert into the ATP. So that's the relationship between the redox potential gradients and hydrogen potential gradients, and eventually it will become chemical potential energy, which is in the form of ATP. And as you see here, that the mitochondria, it is a photo, electro, and chemical rechargeable battery. Because when we eat food, it will degrade, oxidize, and become NADH, right? And then the NADH, which contain the high potential electrons, will be delivering it to the oxygen and release that energy. So how we can energize the mitochondria? By giving them food. Or we can energize the mitochondria by light too. The light can lead to activation of cytochrome oxidase electrons from there, which that electrons will oxidize the oxygen and become superoxide. And also the photomedicine, and we're going to have an animation to explain it, it can cause the release of nitric oxide and block the cytochrome oxidase, and that could cause more of the delivering of electron and developing the superoxides. And so it facilitates and it increases the redox potential gradients between the matrix and the mitochondrial inner membrane. And so that leads to recharging the whole battery. Also, electrotherapy We thought about electrotherapy when we are using it for TENS unit or spinal cord stimulators, that they are interrupting the signal of pain by hyperpolarization of the pain neurons. That's what we know, right? But the fact is that also electrotherapy, especially the microcurrent therapy, can neutralize the free radicals. And they can maintain and generate negative redox potential in the cytosol, which will lead to generation of redox potential gradient between the matrix of the mitochondria and the inner mitochondrial space, or the cytosol, and that itself is a potential energy that can be used to transform into hydrogen potential gradients and then eventually to the ATPs. So we see that all those energy medicine works by increasing the redox potential gradients. And so, not just that, the superoxide that's inside the matrix of the mitochondria, in addition, they help to increase or develop the gradients of the potential gradients or redox potential gradients and regulate the flow of energy. Those redox or those superoxide can be leaked out to the outside of the mitochondria, and it can cause stressing the genes of the cells to produce antioxidants and also growth factor. And the process is called mitohormesis. All of this, we're going to explain it in the coming slide with more clear animation. So it's not easy, it's very complex, but I think with the coming slide with animation, we can break it down and make it simple. So, because the big pharma failed to recognize the critical role of rheostatic nitroredox imbalance in the pathogenesis of chronic disease, Nitromedicine is the new specialty that focuses on developing diagnostic and therapeutic protocol and products to enhance stem cell therapy and manage chronic diseases based on modulation of nitroredox sensitive biochemical pathway. This is the nitroredox sensitive biochemical pathway, which is a translation of thousands of research. And as you see, through the modulation of nitroredox sensitive biochemical pathway, we can manage all kinds of chronic diseases, starting with obesity, diabetes, hypertension, degenerative disease, autoimmune disease, cancers, by using the nitroredox modulators, whether it is biological or energy or chemical, as we discussed before about those specifications. So by modulation of nitroredox sensitive biochemical pathway, by increasing the nitroxide bioavailability and buffer the redox, we can stimulate the mitochondrial biogenesis, activate the beta oxidation, and burn the fat and manage obesity. And I think that's one of the applications of photomedicine. They're using it for treating obesity, right? I think the company is called Zerona. $80,000 equipment and radiate the infrared, but they don't even know how it works. But how it works, it increases the nitroxide bioavailability of the redox, which leads to increase the mitochondrial biogenesis, and that leads to burning of the fat. The other thing is that by modulation of nitroredox sensitive biochemical pathway, we can increase the insulin sensitivity and manage diabetic mellitus complications such as diabetic neuropathy, diabetic angiopathy, and diabetic wounds. Do you know metformin is the drug that we use for diabetic 2, right? And how it works, metformin, is increasing the nitroxide bioavailability. They actually work for a second messenger, which is increasing the nitroxide. And that's how it will open up the sugar channels and allow the sugar to move in. So increasing by modulation of nitroredox sensitive biochemical pathway, by using those nitroredox modulators, whether it is photo or electro or certain like alpha lipoic acid, thiols, they all can increase the sensitivity of insulin sensitivity and manage diabetic mellitus complications such as diabetic neuropathy, diabetic angiopathy, and diabetic wounds. And also, by modulation of nitroredox sensitive biochemical pathway, we can improve the endothelial function, decrease the oxidizing LDL, increase the HDL peroxidase activity, and manage hypertension complications such as peripheral vascular disease, chronic heart disease, and arteriosclerosis. By modulation of nitric oxide-sensitive biochemical pathway, we can unblock the glutamate transporters. We can unblock the glutamine synthase. We can unblock the superoxide dismutase, restore neuroglia antioxidant capacity, and activate the NMDA receptors and manage gliosis, apathy, hyperzesia, allodynia, neurocytotoxicity caused by the overproduction of glutamate, and so neurocytotoxicity symptoms, opioid dependency, which are caused by chronic use of narcotics. By modulation of nitric oxide-sensitive biochemical pathway, we can inactivate indole dioxygenase, decrease the tryptophan degradation, increase the serotonin level, and manage depression. By using photodynamic therapy as a nitric oxide modulator, we can increase the free radicals and increase the redox potential level and shift the Th2 to Th1 and induce apoptosis and cytotoxic immune destruction of cancer cells and pathogens. That's how photodynamic works. It works by increasing the free radicals, and that leads to damage to those cancer cells. By modulation of nitric oxide-sensitive biochemical pathway, or by using nitric oxide modulated polyphenol as a nitric oxide modulator, we can block the COX, increase the capsase sensitivity to redox signaling, and induce cancer stem cell apoptosis. By using nitric oxide modulators, we can modulate the immune system, shift the Th1 to Th2, Th2 to Th1, and manage autoimmune diseases and allergies. By using nitric oxide modulators, we can increase nitric oxide bioavailability, buffer the redox potential, increase telomerase activity, enhance stem cell therapy, stimulate stem cell proliferation, differentiation, migration, and manage degenerative diseases and age-associated disease. By using nitric oxide modulators, we can increase nitric oxide bioavailability, buffer the redox potential, restore the autonomic nervous system balance, and manage autonomic neuropathy and complex regional pain syndrome. By using nitric oxide modulators, we can neutralize free radical, increase nitric oxide bioavailability, buffer the redox potential, inactivate the COX and LOX enzymes, and increase the anti-inflammatory cytokines and manage pain conditions. If you apply the Nitromedicine 10 recommendations on your patients, you shall free them from the curse of oxidative stress-related disease and receive Nitromedicine board certificate signed by the team of Nitromedicine. This is the 10th recommendation of Nitromedicine. So, oxidative stress-related disease caused by decreased nitric oxide bioavailability, which is due to impaired nitric oxide production and or increased activation of nitric oxide by reactive oxygen species, are associated with endothelial dysfunction, autonomic dysfunction, sweat gland dysfunction, telomerase dysfunction, and glutathione reductase dysfunction, which can be diagnosed by endothelial function tests, autonomic nervous system tests, pseudomotor telomere tests, and the ratio between oxidized glutathione and reduced respectively. So what would happen if you have imbalance in nitric redox? I think that imbalance of the nitric redox is the cause of aging, right? Why we are aging? Because we are rusting. Rusting by increasing the free radicals, which eats our body, right? And so when you have this imbalance, when you have reactive oxygen species overproduced or with aging, of course the ratio will be increase in reactive oxygen species versus lowering the nitric oxide, because your body will not produce enough of nitric oxide and produce too much of free radicals, and that leads to the aging and damaging and shortening of the telomerase. But that's the mechanism of aging. It's actually literally it is rusting by free radicals. We mentioned that redox potential and nitric redox status controls the autonomic nervous system. So what will happen if you have imbalance in your nitric redox status? You have low nitric oxide, high free radicals in the body. That's happen when you are sick, or you are depressed, or you are anxious, or a lot of conditions can lead to increase of free radicals. And so nitric oxide inhibits the sympathetic tone, keeps the sympathetic low. and it stimulates the parasympathetic tone. So if you have low nitric oxide, high free radicals, then you will have sympathetic overproduction. Now, sympathetic overproduction stimulates the NOx enzyme, which leads to overproduction of reactive oxygen species. Reactive oxygen species consume the nitric oxide and lower the nitric oxide again. That leads to more of sympathetic overactivity, more of production of reactive oxygen species, and that leads to damage in the organs of the heart, and it can lead to heart dysfunction. It can damage the autonomic nervous system itself. It can lead to autonomic dysautonomia. It can lead to complex regional pain syndrome. So stress, too much of free radicals, condition that leads to too much of free radicals in the body, pathological ones, it can definitely cause deterioration of the organs of your body and speed the process of the aging. And control the autonomic nervous system by increasing the sympathetic. And sympathetic, it's a pro-oxidant arm of the autonomic nervous system. And it increases the free radicals far more. And so, how we can manage or lower the free radicals? Well, being happy, trying hard to increase your parasympathetic by doing things that helps to increase it. Gazapa maneuver is one of the things that you can do. Take a deep breath, right? Relax. Increase your parasympathetic, because parasympathetic negates the sympathetic and it will lower the redox production and the free radicals. So if you want to live long and you want to keep that balance as much as you can, try to live happy and healthy and energetic. Because any conditions that leads to increasing the free radicals, it will speed the whole process of the degeneration and the aging. And a good example, when somebody injures his knee, what will happen? The process of the aging of that knee will accelerate, and the aging process. And one of the reasons is because of the free radicals itself. So I have a patient, and he's been diagnosed with complex regional pain syndrome. One of the diseases that's hard to be treated. In fact, there are some cases they end up amputating their arms. And he's a 40 years old man, presented to my office with a history of left arm pain and swelling for a duration of 5 years. The patient twisted his left arm at work while drilling a hole in the ground. He was diagnosed with ulnar nerve entrapment and underwent a complicated ulnar nerve dislocation surgery, which progressed into left upper limb complex regional pain syndrome, and he received series of unsuccessful left cervical ganglion steroid injection block. The patient suffered 5 years of constant and severe left upper limb swelling, deep aching pain, allodynia, hypergesia, and discoloration, and he was on the highest dose of narcotic without relief. He lost his job, disabled, and sustained a harsh economic and social life. After 6 months of series of blue and infrared and red photobiomodulation therapy on his left arm and left cervical sympathetic ganglion, along with application of topical nitro-compounding medications, the patient recovered from his pain, weaned from the narcotic, returned back to his work, and he was able to perform his normal daily activities. So this is an example of how we can manage complex regional pain syndrome using photomedicine and nitro-compounding formulation. Topical cream contain nitric oxide donors and redox buffers, thiols, polyphenols. Okay, so here, what would happen if we have imbalance in nitroredox? It will cause endothelial dysfunction. Have you heard about endothelial dysfunction? I think everybody's clear about it, right? Endothelial dysfunction, those free radicals will be eating your endothelium, and the endothelium will not be able to produce enough of nitric oxide. In fact, they will be producing endothelin 1. Endothelin 1, in fact, produces or stimulates more of NOx enzymes and overproduction of free radicals. And you end up with that vicious circle of endothelial dysfunction, which leads eventually into hypertension and all the complications of peripheral vascular diseases. So how we manage those patients with endothelial dysfunction? Give them nitric oxide donors, give them phenols, polyphenols. Light therapy can help too. A lot of doctors now, they are doing IV photo, blue light. That helps to buffer the redox and increase the nitric oxide bioavailability and improve the endothelial function. And there's a test for endothelial function test. It's FDA approved, and the insurance do bill for it. So something that I do recommend. Since nitric oxide maintain low tone and high compliance of the small arteries at risk, a reduction of age-dependent small artery compliance is a diagnostic marker for endothelial dysfunction that is associated with both functional and structural change in the microcirculation. These changes are predictive of subsequent oxidative stress-related disease. Therefore, endothelial function testing can be used as an oxidative stress-related disease diagnostic marker to monitor the efficacy of nitric redox modulation therapies. Okay, so the other thing that we can use to diagnose oxidative stress-related disease, like in case we have diabetic neuropathy, is using what we call pseudomotor. And what is pseudomotor? We know that the sweat gland is controlled by sympathetic nerves, right? So what would happen when you have too much of free radicals and low nitric oxide? Those free radicals will eat and damage your sympathetic nerves. So what will happen to the sweat glands? They will produce sweat, but very diluted. The conductance of the sweat will be very low because sympathetic causes the sweat glands to secrete the salt, which is followed by water. And if you have damaging sympathetic, then you would have less of salt secretion and the sweat will be very diluted. And there is a test that can measure the conductancy of the sweat. It's called the pseudomotor. Knowing that the free radicals cause damage in the sympathetic, and sympathetic is antimyelinating fibers. We also predict that the nerve fibers, the C fibers, is also being damaged by the free radicals because they are antimyelinating fibers and they are very sensitive to the free radicals. So measuring the pseudomotor, the sweat gland function, it gives us a diagnostic marker to diagnose diabetic neuropathy. So we can use that to monitor the therapy of nitric redox. Since nitric oxide maintains normal sweat gland function, reduction in sweat conductance is a diagnostic marker for sweat gland dysfunction that is associated with both functional and structural change in the sweat glands post-ganglionic sympathetic and AAC fibers that are predictive of subsequent oxidative stress-related disease. Therefore, pseudomotor tests can be used as oxidative stress-related disease diagnostics tests to monitor the efficacy of nitric redox modulation therapy. So this is the normal nitric redox metabolism. You would have all this kind of diseases, all this chronic disease, mitochondrial infarction, skin aging, coronary kidney disease. The pathology here is due to abnormal nitric redox. It's due to increasing the free radicals and decrease in nitric oxide, which leads to the whole chronicity and damage of those organs. So, what is nitric oxide? It's a gas that transmits paracrine, autocrine signals in the organism. Signal transmission produced by one cell penetrate through the membrane, regulate the function of the same or other cell. The nitric oxide transformed to endocrine signal nitrate, regulate the function of distant cells. So nitric oxide is autocrine, paracrine, and endocrine. I think everybody knows about inhalation of nitric oxide, FDA approved for managing pulmonary hypertension, but they are using it now for managing angina. So instead of giving nitroglycerin, you can inhale the nitric oxide and relieve the angina and possibly also managing stroke. The question is, when we inhale the nitric oxide, how it gets into the heart. It gets into the heart because nitric oxide converts into nitrates, and nitrates will act like an endocrine signal, take it to the heart, And then in the heart, the blood, the hemoglobin, the deoxyhemoglobin will convert the nitrates, reduce it into nitric oxide again, and produce an effect. So nitric oxide here, it is an endocrine, we can say signal or hormone, and it is paracrine and it's autocrine. The discovery of nitric oxide as a signal molecule are awarded with 1998 Nobel Prize at Karolinska Institute. Dr. Robert, a pharmacologist in New York, he concluded that blood vessels are dilated because of the endothelial cell produced endothelial-derived relaxing factor. Dr. Fred, a pharmacologist in Houston, he discovered in 1977 that nitroglycerin released nitric oxide, which relaxed the smooth muscles. Dr. Louis Ignario, a pharmacologist in Los Angeles, he concluded in 1986 that endothelial-derived factor is actually was nitric oxide. And so nitric oxide is known to be an immune and neuromodulator, as well as a stimulator of stem cell proliferation, plays a critical role in analgesia, vasodilation, angiogenesis through the cycle of GMP pathways. It also has anti-cancer, antimicrobial activities, because when they react with reactive oxygen species, become peroxynitrates. And peroxynitrates will kill the cancer and will kill the microbes. And there is a research that's being published in Canada that they're using nitroglycerin to treat prostate cancers and also colon cancer. And one of the mechanisms is that those nitroglycerin, nitric oxide, and the free radical of this cancer will react to those free radicals, become peroxynitrates, and peroxynitrates will eat the cancer by oxidizing the components of cancers. So nitroglycerin, allogenine, and other nitric oxide dominants are widely prescribed medications. And now there's lots of researchers and pharmaceutical companies, they are hybriding nitric oxide with the pharmaceutical drugs. Why? To increase its efficacy and minimize its toxicity. Alright? So nitric oxide is a promising pharmacological agent that has immune modulator, vasodilator, anti-apoptotic, stem cell stimulator, angiogenesis, anti-thrombotic, anti-inflammatory, antimicrobial, anti-cancer, neuromodulator, and analgesic effect. This wide-ranging role of nitric oxide leads to development of great number of synthetic nitric oxide compounds with broad range of therapeutic uses. The mechanism of action of nitric oxide-donating drugs, slow release of nitric oxide, lead to subtle change in the pharmacodynamic of the parent drugs. For example, let's say the NSAID versus the nitroanside, or nitric oxide-donating acid. What is the difference? We know the NSAID blocks the COX-1 and COX-2. What we need is blocking the COX-2. We don't want it to block the COX-1. Because if you block the COX-1, what will happen? It will compromise the secretion of the mucus, and you end up with ulcers. Nitric oxide, when it combined with aspirin or all those NSAID, the nitric oxide stimulate the COX-1 and cause the mucus secretion. So that will counteract the effect of the parent drugs in blocking the COX-1, and it will increase its efficacy and lower toxicity, right? The other thing is that nitroacetaminophen versus acetaminophen. We know acetaminophen, the highest dose that we can use is 6 grams, and then we will have liver toxicity. And why? Because acetaminophen metabolizes into free radical metabolites. If you add the nitric oxide to acetaminophen, nitric oxide works as antioxidant and neutralizes those free radicals, and then your thiols of the liver, which is very rich, will recycle the peroxynitrates back to the nitric oxide. So they find that you can take more of nitroacetaminophen than acetaminophen by itself, because the toxicity level will be higher than taking acetaminophen, which is 6 grams, let's say. With nitro, you can go up to 10. And then we have all other drugs out there that are now being hybrided with nitric oxide. Starting with nitric oxide, aspirin, nitroglycerin, which is used for cancer, nitroparacetamol, which is acetaminophen, using it for pain. We can use nitroxide-donating fluoride biporphine in managing urinary incontinence. Alzheimer's disease, we can use nitroxide fluoride biporphine and nitroxide-releasing ferric acid and tanquine nitroxide donors. Osteoarthritis, we can use naproxenoids. Sickle cell anemia, pulmonary hypertension, respiratory distress syndrome, stroke, TB, chronic obstructive pulmonary disease, we can use inhaled nitric oxide to manage all those conditions. Infertility, we can use genotoxide. Hypertension, we can use the nitrosocaptopril. We can use nitric oxide releasing statin to manage hypercholesterolemia. We can use nitroxide-donating mesalamine in managing irritable bowel disease. We can use muscular dystrophy with a drug is called multidomine, and also diabetic wound. We can use nitroxide, clovinamide, and also nitroglycerin to manage diabetic wound ulcers. So all those drugs have been hybridized with nitroxide to increase its efficacy and minimize its toxicity. But what is the problem of using nitroxide for a long period of time, like nitroglycerin, using it for angina? The problem is generating reactive nitrogen species. That's why when you use too much of nitroglycerin for a long period of time, it becomes peroxynitrate and it eats your heart. And not just that, it also causes tolerance to the nitroglycerin, so you need more and more of it. And other thing is that inhibition of mitochondrial respiratory chain, that's the other bad side of nitroxide, resulting in decreasing ATP production and susceptibility of the cells to death. So, reversible binding of nitroxide to mitochondrial cytochrome oxidase and possible sensitizing the tissue to hypoxia. That's we'll be using it for a long period of time. And the peroxynitrate itself, that is produced from reaction of the nitroxide with reactive oxygen species, irreversibly inhibit the mitochondrial respiration at multiple sites and cause increase in the permeability transition and induction of the cell apoptosis. So what is the solution here? How we can still give nitric oxide and get all the good thing about it and minimize its side effects is giving the nitric oxide with antioxidants. And those antioxidants could be vitamin C, polyphenols, to neutralize the deterioration effect of reactive oxygen species and reactive nitrogen species, maintaining nitric oxide bioavailability. The other thing is detoxification. Everybody's doing detoxification here in integrative medicine. Detox to remove the pathological free radical generators and increase the nitric oxide bioavailability. Low-level laser therapy causes dissociation of nitric oxide from the cytochrome oxidase, hemoglobin, and myoglobin, buffer the redox, and neutralize the deteriorating effect of reactive oxygen species, reactive nitrogen species, maintaining the nitric oxide bioavailability. All these are potential antioxidants. Electrotherapy, TENS unit, spinal cord stimulator, they are not just interrupting the signal of pain. They are actually delivering electrons to the body, which helps to saturate the free radicals of the electrons, thus eliminating the underlying oxidative stress, stabilizing the mitochondria, preventing further formation of pathological free radicals, and increasing the nitric oxide bioavailability. So, the way that nitric oxide works, it activates the guanylate cyclase, increasing the cyclic guanine monophosphate level, which modulate the immune system, increase the blood flow, and stimulate the stem cell proliferation, differentiation, and immigration. And so, what about platelet-rich therapy and stem cell therapy? Of course, if we combine nitric oxide donors with light, we may increase their efficacy. So platelet-rich plasma efficacy can be increased, especially with blue light. Blue light irradiation of the whole blood with 450 nanometers of the whole blood. These two increase the nitric oxide deoxyhemoglobin dissociation, shift the blood redox to reduction state, decrease the peroxynitrate level, increase the nitric oxide bioavailability of the transfused PRP. Also, we can combine the PRP, light therapy, nitric oxide donor, electrotherapy, detoxification with stem cell therapy. It will increase the efficacy of the stem cell therapy. So all this integrative medicine that we are doing, if we combine it with stem cell therapy, we can increase the efficacy and the performance of the stem cells. Because they are all work on the same thing. It's buffering the redox and increasing the nitric oxide bioavailability. So the nitric oxide and the platelet-derived growth factors stimulate stem cells, proliferation, and differentiation. So what will happen when we irradiate infrared and red light in a healthy tissue? It will increase the respiration and the generation of ATP. Remember we say the light increases the redox potential gradients? It creates physiological oxidative state which stimulate the downstream effects. The light excites the cytochrome oxidase electron and it will be delivered to the oxygen and the oxygen will become free radicals. Physiological free radicals. Under normal conditions, a certain proportion of cytochrome oxidase is bound to nitric oxide and activating it. With red light and infrared, it dissociates nitric oxide from cytochrome oxidase, leading to increased aerobic respiration and ATP. So that's one of the ways it will release or the nitric oxide from the cytochrome oxidase, allowing the oxygen to grab those electrons, become superoxide inside the matrix of the mitochondria, which leads to increase the redox potential to the level of 800 and develop that redox potential gradient, which can be converted into hydrogen potential gradients and then to the ATPs. It increases nitric oxide bioavailability by releasing those nitric oxides from the red blood cells, leading to a rise in cyclic GMP and stimulation of stem cell proliferation and differentiation. Reactive oxygen species level increases shifting of redox status to physiological oxidative status. It's very important that the free radicals are not all the time bad. We need the free radicals. We need the physiological level of the free radicals. And let's give you an example so you can understand what's the meaning of physiological versus pathological. I think everybody knows what aerospace people they go to the moon, right? Astronauts. What will happen to them? There's no gravity in the moon. There's no stress. And if there's no stress in their body, the level of the free radical and the level of nitric oxide goes down. So if you go down, the level of free radicals and nitric oxide goes down, what will happen to their muscles and bones? There's no signals really stimulating stem cells. They will end up with osteoporosis and muscle atrophy, right? So when they go back, they have to go through all the physical therapy, slowly get that weight-bearing exercise in order for them to gain that stress, that very important, the physiological stress, to produce those physiological free radicals and nitric oxide level back to normal, right? So how that works, the physiological free radicals that we have in our body, that we can do it by exercise, by the gravity, by acupuncture, by massage, by low-calorie intake, by all these nitric redox modulators, those free, by ozones, right, by oxygen therapy, those free radicals, physiological one, stimulates the genes of the cells to produce growth factors and antioxidants, and lead to the cells to differentiate and proliferate. Those signal free radicals stimulate the cells to divide, proliferate, and differentiate. And when you are building antioxidant, the immune system will shift from the Th1 to Th2 anti-inflammatory cytokines and goes all that kind of healing process. This is called mitohormesis. I know this term is very new. It's called mitohormesis, the process of the physiological free radical stressing the genes of the cells to produce antioxidant and growth factor and stressing the cells to divide and proliferate. This is called mitohormesis. Here's the animation of the infrared. Light goes in release of nitric oxide, and here the oxygen becomes superoxide. And here the shift of the redox status into physiological oxidation, and then the physiological oxidation will stimulate the genes to produce antioxidant, growth factor, and drive the cells to divide and proliferate. So the process of the term is called mitohormesis, effect of low-level laser therapy. Redox potential shifted toward physiological oxidation state, leading to transcription of protective antioxidant genes, anti-apoptosis, enhanced stem cell proliferation, differentiation, and immigration. Similar to mitohormesis effect of the cryotherapy, ozone therapy, cryotherapy, sonotherapy, electromagnetic therapy, acupuncture, electrotherapy, plasma-rich platelet therapy, fasting, physical therapy, exercise. They all work through a process that's called nitrohormesis. Infrared and red under hypoxia or pathological oxidative stress, it's a little bit different. Nitroxide, yes, it will be dissociated from cytochrome oxidase, but because the ratio of the NAD to the oxygen level is very high under hypoxia and pathological oxidative condition, the NAD, not the oxygen, will be the electron acceptor. And so the NAD competes with oxygen as an electron acceptor for the LFT, photoexcited electrons of cytochrome oxidase, which leads to a process called phototrophy. So the energy of the light is being stored in the NAD, and that's called phototrophy. So the nitric oxide that's being released will combine with cyclic GMP level and will increase, of course, stimulating stem cells and cause the vasodilation, increase and reduce in species of NASH and ATP. The level of reduced glutathione will increase, and the cellular redox status shift to reduction and decrease the inflammation. Here's the animation for this. So it's kind of a little bit different, and the whole name here is called phototrophy versus nitrohormesis. Let's go with the blue light. The blue light therapy can cause nitric oxide dissociation from the deoxyhemoglobin in the erythrocytes. The free nitric oxide that's being released then react with local reactive oxygen species forming peroxynitrate. And then the peroxyredoxin, which is inside the red blood cells, will reduce the peroxynitrate to the nitrate. And then the nitrate will convert to the nitric oxide and the water by the deoxyhemoglobin. The end result is reactive oxygen species level are reduced, the nitric oxide viability will increase, and the redox status will shift to reduction. And that's why it's good to treat the blood with blue light and then centrifusion to get the platelets, because that platelet solution will be redox potential, it will be shift to reduction, it will have anti-inflammatory cytokines in it, and I think it will be painless. So that's called photoactivated platelets. Here, this is the animation here. The blue light and how it's causing the release of nitric oxide, become peroxynitrate, and how the hemoglobin recycled back into the nitric oxide. And this is the result. The ROS level are reduced, the nitric oxide viability increased, redox status shifted to reduction systematically. And this is the last thing, which is the animation. Of course, nitromedicine is more than a lot of slides there, but let's end up with this animation here. And hopefully there's sound here. Is there sound here?
Yes.
How does blue LED light relieve pain? Almost everyone suffers from a twinge in the shoulder, pain in the lower back, or even lumbago. Back problems are a common complaint. The treatment with blue LED light provides relief. It reduces the pain. The immediate effect of the blue LED light on the back is a feeling of warmth. Additionally, it triggers natural production of nitric oxide in the body, known as NO. The soothing effect of warmth on pain is well known, but the second effect is innovative. Blue LED light activates the body's production of NO molecules. NO develops within the skin. Once released, it progresses by a variety of routes to the muscles in pain. NO occurs naturally in the human body. It performs important and diverse functions. But what are the effects of NO precisely? The tiny molecules have an enormous effect on the human organism. The NO released by the blue LED light promotes the circulation. This in turn improves the muscle supply of oxygen and nutrients. All in all, this leads to relaxation of the muscles. The pain noticeably lessens. Moreover, NO has anti-inflammatory effects. It also protects the cells and can inhibit further damage to muscles and cells. The major advantage of therapy with blue LED light is its naturalness. The blue light stimulates only the body's own natural processes to relieve pain.
Okay, thank you very much. Do you have any questions? I know it's a new topic. There's a lot of time for explanation, but if you have any questions. Once you accept or understand the redox potential concept, everything will be easy. And start looking for research and publication, which I can share with you. You can have my business card. I can share with you my publication. I have 2 of them. It's in nitromedicine.com. That's the website. And you can get my publication with Dr. Michael Humphrey from Harvard Medical Schools. Yes?
The LED, is it laser?
Yes, well, it is laser. But it's a little bit different from the laser in a way that the laser is more focused than the LED. What is that? Yes, you can apply it, but they are both light, monochromatic light generation, but the laser is more focused, more expensive than LED.
I didn't think that blue laser penetrated.
In white people, it does, but in colored skin, it will be hard. Then you can do the catheter and you can pass the skin part. And you can do it in the blood, IV.
Is this only for clinical use?
This is FDA approved in Europe. No, CE approved in Europe for light therapy application. And here, there is FDA approval for laser. We have a company, Dr. Weber. He bought a system, so yeah, so we have that. It's FDA approved for external use. Yes. Any other questions? Okay, thank you.
There is a reception